Okay, so we're gonna just look at some of the major appendicular structures this week. Again, just reviewing some of the important structures from the appendicular system here. So we're starting off with the clavicle. So we've got two different views of the clavicle. We've got a superior view where we can see the convex nature of the acromial end versus an inferior view where we can see the concave nature of the acromial end, right? So this is where the acromial end sort of curves over where it attaches to the scapula. We've also got the medial end, also called the sternal end, where the clavicle attaches to the sternum. Looking at the scapula, so right away we want to identify this as the left scapula, simply because we're looking at a posterior view, and we can see the lateral aspect where we have the glenoid cavity where the humerus would articulate. We've got the medial aspect, we've got the sort of more straight border. We've got the spine of the scapula. We've got the acromion of the scapula. This is where that acromial end of the clavicle would articulate. And then we've also got the coracoid process anteriorly here. We can appreciate some of the spaces that this spine is creating. So we've got the infraspinous fossa as well as the supraspinous fossa on top. And again, thinking about our view, thinking about the lateral versus the medial end, this is going to help us determine whether we're seeing the left or right scapula. This is the left. Looking at the humerus here. So again, thinking about the orientation of the head of the humerus, remember the medial aspect of the humerus is facing toward the glenoid cavity. And so this is going to be toward the glenoid cavity. So this would be the left humerus, right? This is an anterior view of the left humerus in view 2. This is a posterior view of the left humerus in view 1. Some of the structures we can appreciate at the medial end are the trochlea. The trochlea is going to be on the medial end versus the capitulum or the capitellum. And remember, these are just the articulating surfaces of the distal humerus that are differently named. So the medial side is called the trochlea. The lateral side is called the capitulum or the capitellum. Above the capitulum, we've got the radial fossa. And above the trochlea, we've got the coronoid fossa, which are these depressions in the bone for the forearm bones to articulate. We've also got the medial epicondyle, again, toward the medial side, and then the lateral epicondyle on the lateral end, okay? Here we can also appreciate the tubercles, so the greater tubercle versus the lesser tubercle, which are these projections on the lateral aspect of the humerus. Looking at a posterior view, the only visible feature here is the olecranon fossa, which is a large depression in the posterior view, accepting the olecranon process of the ulnar bone. Here's a view of the radius. So we've got the head of the radius, the neck of the radius, the entire body, so to speak. And at the distal end, we've got the styloid process. So the styloid process is going to be the lateral articulation, right? So the lateral articulation, because the styloid process is the lateral forearm bone. And that is going to be this projection toward the distal end of the radius. We've also got this bump-like projection on the medial side of the radius, which is the radial tuberosity. Looking at the ulnar bone, we've got the olecranon process, right? We've also got the trochlea notch, so this groove or depression that articulates with the trochlea of the humerus is called the trochlea notch. We've also got the coronoid process. So this is that process that sits in the groove above the trochlea on the humerus as well. So really appreciating the articulation between the ulnar bone and the humerus in terms of these fossas and processes. We then have on the distal end, the styloid process as well. So the styloid process is found on both the ulna and the radius at the distal end of both bones. Okay, let's look at the hand bones here. And here we can appreciate the phalanges, which are the finger bones, as well as the metacarpal. So the phalanges, proximal phalange, middle phalange, and distal phalange, as well as the metacarpal. So the adjacent or adjoining bones between the carpals, which are the wrist bones, and the phalanges are called the metacarpals. So these long bones here are the metacarpals. Now, we're usually looking at an anterior view of the carpal bones. And so we can appreciate the carpal bones going from lateral to femoral, going from scaphoid, lunate, triquetrum, pisiform. And then the distal row, we've got the trapezium, trapezoid, capitate, and then hamate. And hamate actually has this hook-like, which is hanging off here at the medial end, okay? And from a medial view, what we can appreciate is the hamate, right? The hamate sort of sticks off there, not hamate, excuse me, the pisiform, which sort of sticks off here from the triquetrum. Okay, let's look at the hip bones here. So the hip bones here, we've got a lateral posterior view of the hip bone. We can see the acetabulum, which is a shared structure. We can see the obturator foramen, which is another shared structure. And then we can see the three divisions of the bone. So the top part being the ilium, the posterior inferior part being the ischium, and the posterior anterior part being the pubis, okay? We can also appreciate the greater sciatic notch, the greater sciatic notch here, the lesser sciatic notch, the ischial tuberosity here. We can appreciate the ischial ramus, the inferior pubic ramus, the superior pubic ramus as parts of the lower half of the bone. We've also got the articulating surface, the auricular surface where the hip bones attach to the sacrum. And then we've got the iliac crest. So the curvature of the ilium is the iliac crest. And then we've got the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. Here is the pubis symphysis. So the region where both halves of that pubis bone attach is called the pubic symphysis. Okay. Another view of some of those structures, ilium here, acetabulum, the pubic bone, the ischium bone, ischial tuberosity, the ischial spine here, the greater sciatic notch, and then the lesser sciatic notch. Okay, another view here, the pubic bone, right? Specifically the attaching point where we have the pubic symphysis there. We've also got the superior and inferior pubic ramus, the ischial ramus, and then the ilium on top here. Here's again that look at that auricular surface. Okay, looking at the femur, we've got the head of the femur, right? Medially facing, we've got the neck of the femur. We've got the greater trochanter, which is the outer large projection. We've got the lesser trochanter, so better seen on a posterior view here. So greater trochanter upper and laterally, lesser trochanter medially and inferiorly. And together these are connected posteriorly via the intertrochanteric crest. But if we're looking at their anterior connection, this is called the intertrochanteric line, okay? And in order to determine anterior versus posterior, you're really gonna wanna look at the distal end of the femur. So the patella surface tells us we're looking at the anterior femur, and so the trochanters are connected via the intertrochanteric line anteriorly. These two projections here, so the epicondyle surfaces, the condylar surfaces, excuse me, on the posterior end are denoting that we're looking at a posterior view. And so here, these two projections are connected via the intertrochanteric crest. Looking at the patella, so in terms of a posterior view of the patella, we've got the larger lateral surface, the smaller medial surface, the base of the patella being on the top, and the apex of the patella being on the bottom. And again, you should be comfortable sighting the patella based upon that information. So if this is the lateral surface, which is larger, if this is the medial surface, which is smaller, this must be the left patella. Okay, same thing here. So we've got the larger lateral region, the smaller medial region, and this would be the anterior view of the left patella. Moving on to the tibia, so we've got the articular surface of the tibia up here. We've also got the tibial tuberosity, so this bump-like projection on the anterior aspect of the tibia. Again, this will help us to figure out that we're looking at an anterior view of the tibia because of the tibial tuberosity where the patella ligament inserts. At the distal end of the tibia, we've got the medial malleolus here. So here's that medial malleolus from an anterior view, and then medial malleolus from a posterior view. Looking at the fibula, so here's the fibula. We've got the head of the fibula this way, and then the lateral malleolus, which is at the distal end. Lastly, looking at the foot bones here, so we've got the tarsal bones, right, starting with the talus on top, the calcaneus on the bottom, the navicular, which is anterior to the talus, the medial, intermediate, and lateral cuneiform, so medial cuneiform, intermediate cuneiform, lateral cuneiform, and then the cuboid bone, which is the most lateral tarsal bone. And then we've also got the metatarsals, which help to articulate the phalanges or the toe bones with the tarsal bones or the ankle bones. So the metatarsals, and then the proximal, intermediate, and distal phalanges. So there is no intermediate phalange found on the great toe, just like there's no intermediate phalange found on the great finger, okay, or the thumb. Another view, so again, you should be comfortable siding the foot bones, right? This is a left foot versus a right foot, and looking for the laterality of the bones, as well as looking for the great toe. So the great toe will be medially facing, the smallest toe, the pinky, will be laterally facing. The cuboid will also be laterally facing, whereas the navicular is found on the medial end.